Welcome back. I still have Mary and Kipkerich with me here in studio. Mary, there was this story about the World Health Organization that had revealed about 1.3 million Kenyans living with HIV and AIDS might have been diagnosed wrongly. So we've seen the World Health Organization coming out and separating itself from that specific story. But that leads me to my next question of quality, the quality of these packs. And as we talk about the quality, probably we could open one?
Yes.
Go ahead.
So maybe Kipkerich can talk about it as I open.
Yes, Kipkerich, please, the quality.
So basically, quality assurance begins with the entry point is the product where the KMLTTB appointed the National HIV Reference Lab as an institution that will be able to do quality assurance for all rapid kits under the Division of National Public Health Labs. And basically, they do the validation, verification of the alleged manufacturer's claims that the kit performs to satisfaction. And basically, they use a gold standard to compare it with these kits, and they're able to accumulate data and analyze the data and present the reports to the regulator for approval and registration. From there on, they also produce a proficiency testing panel. These are panels that we produce. These are positive samples, negative samples that are produced in the lab. And they are able to test the competency of service providers and also test the product whether it's working. So it is sent to facilities, and every provider have been listed. About more than 10,000 HIV service providers who are testing are enrolled on this particular scheme, and they are tested quarterly basis, at least twice a year or on quarterly basis. And basically the reports are collated and analyzed, and the interventions are carried out to make sure that we narrow the gap and reduce. Of course, we do get some unsatisfactory performance, and we do interventions, service interventions, which is a package. And to that, we will build the quality chain within the system. And
all right, continue.
Yes, for us, strengthening the system is the key thing to deliver quality results.
All right, speaking of quality results, Mary, now back to you. Show, take us. So this is the one for the
oral.
Or the oral.
This is an oral test.
Okay.
And this is the solution of which you need now. So we have our spatula here, and this is what you use to scrap your gums. So it's not saliva, but the gum.
The lining of your gum?
The lining of your gum.
Okay.
So the upper gum, the lower gum, and then we'll put it in this solution. And in 10 minutes, you can read your results.
That's simple.
That's simple.
Speaking
so
of...
we have, this is where you look at your results. And we have the control line and the test line. And if you see 2 lines, it's positive, and 1 line.
Could I hold that for our viewers?
Yes.
Awesome. All right, so you said if you see 2 lines?
Yes, 1 at the control and 1 at the test, it's positive. If you see just 1 at the test, 1 at the control only, it's negative. So for the one that you see 2 lines, you need further tests at the health facility. Do not conclude. Just go to a health facility or call our 1190. We also have our app where you can talk to our provider, Be Sure MOH app, which you can download on Play Store, and that is able to guide you on what to do next. About
the issue of the quality, we said that this costs about 500 Kenyan shillings in Nairobi and Mombasa. Yes. What about in low-income areas, Kipkerich, like Kawangware, like Kibera? 500 Kenyan shillings for someone like that it's a meal.
It is interesting because according to the poverty index, where a sizable population of Kenyans are living under $1 in a day, and you put the self-test kit at 400 or 500 shillings,
right.
Actually it is unaffordable for them. And what we need to do is we need to encourage them to go to health facilities of their choice, because testing is actually free in those health facilities. It is funded under PEPFAR, under Global Fund. We are buying kits, and this service is available at the health facilities. We just want them to have confidence that the results that we get are accurate and reliable to be used for diagnosis. And why we want to encourage people to test is basically for prevention, identifying the positives, and actually providing care and treatment for them, because there's a value in early diagnosis of HIV.
Mary?
Yeah, so as he says, so if you can't afford it, you'll get it for free at a health facility. If you're the high end and you can afford it, you can buy it for 500 shillings. But we're working on bringing the cost down because this is subsidized cost by partners, as he says, PEPFAR, USAID.
Speaking of stigma, Kipkerich, what strategies can we use to fight stigma, especially amongst young people and the male group?
I might not be a stigma expert, but basically one is already currently there is a survey taking place in Kenya called KenFear, and I think our minister, Cecil Kariuki, is going to launch it in Safari Park on 5th of June.
Right.
And this survey has some of the questions on stigma index that we need to collect, especially now that we look at communities where there's really high stigma and people are not likely. Stigma is a barrier to service. And basically even HIV self-testing is still a barrier because they know if I test positive, everybody will actually judge me.
Right.
And they'll be able, certain things in life, my fundamental rights will be violated by individuals. So basically, and those rights is something that we need to advocate. You as for the state, you need to devise, also work together with the Ministry of Health to be able to handle the issues of stigma in communities, selected communities. In some communities, we've had a headway, like in Nyanza, where stigma levels have gone very low because they've accepted this particular HIV infections as basically like any other disease in the country. And healthcare workers have been sensitized. They have no issues in handling the levels. And in Nyanza, it's a good example for us. And maybe we need to benchmark communities, where communities will visit and see why is these facilities having lower stigma index compared to others.
All right. Mary, in regards to, as a country, what is the positive economic influence or impact of a country knowing its HIV status? The economic impact. I think we overlook what a country that knows its HIV status, how that then reflects to an economic boom.
Okay. Thank you, Zinzi. The economic impact is when you know your status and you're living with HIV, you can take your ARVs and you live for longer. That way you can be able to contribute to the GDP of this country. If you're dying, if young people are dying and we're having people who, professionals and people who are making money, dying and leaving their families destitute, then it doesn't work very well for the economy. So we are looking at it in Kenya as looking at where we have come from. If you tested in the 1990s, people used to die very fast and we lost a lot of people. But now we have come very far and we've made a lot of progress as Kenya. Right now our prevalence is 5.6. Before it was very high. And well, I think we have made progress. In terms of access, everybody is able to have their ARVs now. Now you don't need to die of HIV complications like it used to be before.
Very true.
So we feel we have contributed positively as a ministry in terms of the economic performance.
Thank you so much, Mary. Mary and Kipkerich, they're helping us understand the self-testing kits that you're currently seeing on air. Mary Mugambi is a program manager for the self-testing within NASCOP, and of course Kipkerich Bera, who is the program lead for Global Fund from the National Public Health Labs. This conversation on your health still continues, because up next I'll introduce you to Janet Mbugua. She's a lady who needs no introduction, but before we can do that, let's set the stage. Now, sex for pads is something that has become quite controversial, especially here in Kenya, where you have young girls having to do impeccable things just to get a packet of pads. Take a look at this story.
KTN News revealed in early August what many see as a normal body function is leading young teenage girls into the hands of sexual predators who promise to buy them sanitary towels. The dangerous trend then snowballs into poor class attendance, early pregnancy, sexually transmitted diseases, and ultimately a spike in the number of female school dropouts every year. Well, for these girls from Kwangamore High School, this may be a thing of the past. This is after a group of well-wishers decided to take a step and make a difference in the girls' lives by supplying them with the precious goods.
It was through KTN News that I watched early August for consecutive 2 days. And then I thought of what I can do about this school, because the story was not encouraging. It was really heartbreaking.
The lack of sanitary towels, however, is just the tip of the iceberg. As the school leadership explains, the problem stems from the family setup.
Wazazi ni kama hawaelewi ya kuwa wanatakikana wapewe vifaa za sodo.
This being a problem that affects far more than just this one school, the group has its work cut out for them. But determined to protect the dignity of young girls, some who've resorted to using plastic bags, rags and old t-shirts during that time of the month, they say they will do all they can to support the teens.
Finally, we are here. We have more than 4 schools of 650 girls that we are providing them sanitary towels for 3 months.
News that has many of the girls breathing a sigh of relief.
Actually, last week I was away because of this problem, but now, as I have received, I thank God and also I thank you. I'm going now to stay in school.
Naweza kuimarika vizuri kwa sababu ile time ninge west kwenda sometimes maybe nimeanza MP class wamesema enda home uvae pad ndio urudi.
However, with the education and dignity of young girls in schools at risk, the fruition of what the Amendment Act promises is perhaps years overdue. Trix Ingado, KTN News.
And this is what Amina Mohamed as well as First Lady Margaret Kenyatta had to say when it comes to this issue. Take a look.
Regular retention of girls in school. We also reported enhanced performance and better performance by girls, and the transition of girls from one level to the next.
We recognize that women's health, especially menstrual health, is an important aspect of reproductive health, yet is not often talked about. As a result, many barriers towards reproductive health management persist and remain a challenge for thousands of women and girls. And today we are reminded that we still have a lot to do to eliminate the stigma, cultural and social barriers that infringe on safe health practices for our women and girls.
And as I promised, Janet Boko is here. She is the founder of Inua Dada. Janet, it's so good to see you.
It's so good to see you, Zinzi.
When was the last time you were on TV?
Oh my goodness, April 10th. Well, I've done a couple of interviews on TV since I left.
Right.
But my last show was on April 10th, 2017.
Now, we've had the First Lady saying the issue in regards to stigma. How can we as a nation fight this whole issue of stigma when it comes to menstrual cycles, something that is such a natural phenomenon?
Exactly. Thanks for that, Zinzi. It's so sad that at this day and age, menstruation, conversations around it are still considered taboo. A lot of girls and women are still stigmatized. And what's even more concerning is the lack of access to sanitary products, whether it's girls or women. There's so many. There's 10 million girls and women who menstruate in Kenya. That's
10 million.
10 million. This is statistics from the Ministry of Health and UNICEF. I do a lot of work with UNICEF as well. And, you know, not that many of us are lucky enough to be able to access these sanitary products. You'd be surprised. You and I are the minority. A lot of women and girls struggle. And so what we need to do, we need to engage. The conversation has really scaled since I started Inua Dada Foundation a few years ago. Yesterday, there was a menstrual health management symposium in Johannesburg. We had the menstrual hygiene day. We've seen, you know, CS Amina, we've seen the First Lady, and we've even seen men like King Kaka doing something. So the conversation needs to be normalized. That's the only way we can begin to see this as a transition and not a disruption, because it disrupts the lives of so many girls and women, especially girls. Someone as young as 8 years old, 9 years old, no one has talked to them because you expect them to be 12 or 13 before they start their menses. But if we have this conversation and engage and normalize, then I think we'll be making some headway.
Speaking of period poverty, is it that we don't have policies in Kenya that's supposed to govern this? Where is it? Where are the loopholes? Because when you have 10 million women and girls in Kenya who have their menstrual cycle, then you have young girls as young as 8 having to give things just to get a packet of pads. Where are we going wrong as a society, as a government?
That's such a good question, Zinzi. I'll address some of the issues in Kenya, but you'd be surprised. Period poverty is global. Period poverty is in Scotland. Scotland, you know, it's in the United Kingdom, it's in Los Angeles, it's in India, it's in Kenya. So around the world, there are women and girls who do not have access to sanitary products. And I know in a country like Scotland, they're trying to make sure that these products are going to be free. I think it's in the works and it'll happen soon. In Kenya, we have seen the government starting to step up. Recently we saw Professor Kobia, the CS for Gender, flag off sanitary towels and panties for girls across Kenya. We've again seen the First Lady. We saw President Kenyatta sign into law the bill to make sanitary pads free. We don't have implementation. That's a very big issue. When you asked what are the issues, implementation needs to happen so that if a girl is getting a free exercise book, she gets pads and a panty. The other issue is lack of infrastructure, like, sanitation. You have girls who have their period, but they have nowhere to shower, nowhere to sort of like clean themselves.
Yes.
Disposal is a very big issue, so you have girls and women throwing their pads in pit latrines and them filling up. So we need infrastructure around wash facilities in schools, especially. We need implementation of policy. We need to not have sanitary pads taxed in this country. It's ridiculous that they're still taxed, which kind of means they're considered a luxury good. And it's not a luxury, because at one point or another, most, if not all, women and girls are going to go through this process. And so we are seeing a change happening. The government is trying to step up, and I want to commend them for that. It still needs to be more. When you have such a huge percentage of girls, particularly in areas like in Western Kenya, trading sex for pads, that makes you realize if we don't make these pads or sanitary products, I say sanitary products because it be disposable pads, reusable pads. If we don't make them available, if we don't educate these girls about what's happening in their bodies, educate the boys and men, we are going to continue seeing 14, 15-year-old girls trade their bodies for pads. So we need better implementation of policy, better engagement. We need regulations, because a lot of people ask me, what about reusable pads? It's not that they're bad, but they need to be regulated. Are these girls washing them properly? If you don't, that's a health hazard for them. So there's still a lot that needs to come into play, but so far, at least, where we were 5 years ago, we're in a different place today.
Okay, and we're going to keep making progress as a nation.
We will.
But making progress as a nation, we need men on the table.
We do.
We need the likes of King Kaka. So what is the role of men in menstrual health? And how, because we don't want them to be shy. They need to be part of the table and part of the conversation. How do we loop them in?
I think when the girls start, so right now in school, this program needs to be, it almost needs to be compulsory. Reproductive health is such a by the way a lot of the time. It's just like, yeah, this is what's happening to your body. Anyway, moving on. We need to be intentional about teaching our girls and boys on what's happening to their bodies. And when you're talking to the girls, make sure the boys are in the room. Because then, culturally in Kenya, there's this whole thing for, no, there's some things we can't really say when boys are in the room. But if they don't know, they're the same ones who'll be giggling when a girl steps out and she's stained herself. So I think that's how we get boys knowing it very early. It starts in school. It starts with the curriculum, addressing it from a very young age. So the role of men is to support and understand that this is your sister, your mother, your cousin, your friend. All these girls in your life and women are menstruating, and sometimes it comes with so many issues, whether it's endometriosis, whether it's lack of access to products. It will affect your life if there's a woman in your life who doesn't have access, who is sick, who isn't informed. So it's great to see what people like Nkaka are doing. There's a lot of other men who are beginning to understand that, wait a minute, this is an issue. It, at the end of the day, can also affect your economy, because you have girls who can't access pads, so they can't go to school. They miss out almost a month and a half worth of school in a year. So what's going to happen? They're very vulnerable to early pregnancy, to HIV, and then they're not contributing to their households in future.
They can't even compete in class?
They can't compete in class. You can't perform and attend school because of your menstrual period. And why should it be a disruption? Surely it's a transition. We need to just make it more efficient, especially for girls who come from vulnerable areas. We need to normalize it and be like, this is going to happen. It's okay. You're fine. Don't be traumatized. This is how to use a pad and panty. This is now what you need to know about your body, about your hygiene, and make sure the boys are aware, because they grow into men who are exposed and don't laugh at it or see it as an issue. So we need to engage men when they're boys and then continue having the conversation with them. I think that's what can happen.
So looping them into the conversation as early as primary. When the girls are being taught these things, they need to be there.
They do need to be there.
All right, so we've talked about the government's role and even the role of men. Private sector. How can the private sector contribute to menstrual health here in Kenya and even on the African continent?
So I think private sector has probably been one of the more active, because they're able to maybe use their CSR. What I would probably say is it needs to be more streamlined. We need the private sector to say, we are going to be intentional about dedicating some of our resources to improving menstrual health management in Kenya. So it's not just touch and go, where you distribute pads for 1 year and then you kind of like leave these girls. Remember, they're not going to menstruate for 1 year. So if possible, if a couple of them could commit and say, we want to walk with girls in Kenya and we want to commit our resources, because resources is needed if we're going to improve infrastructure, if we're going to improve mentorship, if we're going to improve adolescent health. So the private sector needs to invest more. There's many of them who are doing an incredible job, but like I said, a lot of the time you find it's very touch and go. There needs to be a lot more consistency. So if the government and the private sector and people like you and I can come together, because this affects someone in our lives, then we have a normalization of this transition and we're aware of the vulnerabilities.
All right, menstrual health was on 28th of May.
Yeah.
What are your closing remarks?
No more limits, you know, and that was the theme this year. We cannot in 2018 be having girls and women have to choose between food and a pad.
It can't be.
It's so unfair because they need to eat, but they also need to menstruate in a hygienic manner, with dignity, with confidence. So my closing remarks are, let's all get on board in this conversation. I know sometimes we feel like these conversations they have a lot of fatigue. We keep having them. But until something is done, something that's concrete, something that's streamlined, we will have a lot of suffering. So no more limits, no more stigmatization, no more taboo. Let's come together and make sure that girls and women around the world menstruate with dignity.
All right. Well, we've had it from Janet Bugwa. She is the founder of Inua Dada there, giving us an overview of menstrual health here in Kenya and really on the African continent. No more limits, you've had it, and of how we can also loop men into the conversation. Michael.
All right, and well, it is definitely a conversation that needs to continue.
Yes.
And it's all about getting a level playing field, both for boys and girls, because you can imagine how unfair it is for boys to be going for a lesson and girls for the same lesson. They're expected to do an exam at the end of the year, yet the girl has had so many challenges in between that year, especially when they don't have just the basics for menstruation. So it's a conversation that needs to continue. Thank you very much, Janet, for joining us this morning. Zinzi, asante sana. But you know, time waits for no man, and it's time for us to say goodbye. And like we say it here, it's a wrap. But do stay with us right here on KTN News. News Center is lined up for you. From me and from a very able team, we'd like to say thank you for watching. Do have yourselves a great day. God bless.
KTN News. Get the whole story.